What happened that the world has come to stand still? All of a sudden, the hustle-bustle in the public places, malls, and traffic highways turned into silence. The lives of people has turned upside down. In today's world, one can't imagine in dreams that they had to confine themselves in the four walls of the homes, with no outings and unable to meet our friends and relatives. The reason is the pandemic COVID-19 outbreak, originated in Wuhan, city of central China. The villainous coronavirus is killing thousands of people, and making them helpless. As of June 8, the global death toll surpassed 400,000 amid more than 7 million cases worldwide. But this kind of pandemic is not happening first time in the history of mankind. 100 years back then, in 1918 to 1919, the worst flu in recorded history killed an estimated 50 million people worldwide, about one-third of the planet's population. The Spanish flu. It can be also proclaimed as warning from history. Considered the biggest and deadliest pandemic in modern history, the Spanish flu has been dubbed as the worst catastrophe of the 20th century, infecting an enormous number of people who died very quickly. It killed more people in 1 year than World War I. Also more than the 4-year Black Death bubonic plague from 1347 to 1351. Let's go through the Spanish flu timeline and some visuals. In late 1917, military pathologists reported the onset of a new disease with high mortality that they later recognized as the flu. The first official well-attested cases of Spanish flu were reported among Army recruits at the U.S. Army's military camp Funston, Kansas, USA in March 1918. They had no reliable diagnostic test and no really good treatments. A newspaper report on the Spanish flu in 1918 left a colorized image of the 1918 virus taken by a transmission electron microscope. Map depicting the Spanish flu pandemic 1918, the geography and mortality of the 1918 influenza pandemic. In a 2014 report titled, Paths of Infection, the First World War and the Origins of the 1918 Influenza Pandemic. A lot of nurses and medical workers were also getting sick. Hospitals were overwhelmed. The global pandemic has led to sweeping changes in nursing and the healthcare industry. Historical records show that since cremation was an uncommon practice at the time, America struggled to bury the dead. The sheer number of dead bodies overwhelmed the capacity of undertakers, grave diggers, and casket makers to keep pace with the arduous task of burying the dead. American Samoa implemented a 5-day quarantine for all boats that kept influenza from its shores until 1920. Prohibition on public gatherings that included funerals and wakes compounded the pain of many grief-stricken families who could not properly mourn the loss of their loved ones. The Australian island of Tasmania implemented strict quarantine measures for boats arriving on its shores and required all passengers and crew to be isolated for 7 days. When the infection penetrated the island in August 1919, medical officers reported that it was a milder infection than that on the mainland. The death rate on Tasmania was one of the lowest recorded worldwide. Policemen in Seattle City, wearing masks made by the Seattle chapter of the Red Cross during the influenza epidemic, December 1918. A single virus strain probably affected all Pacific Islands. We think it infected about 500 million people, so 1 in 3 people in the world alive at that time, and it killed 50 million of them. The death toll could have been even higher because there was a big problem with under-reporting at the time. They didn't have a reliable diagnostic test. The pandemic ended simply by running its course, without significant human intervention. Now, we know that it was the influenza virus that killed millions.